Is that time worth your child's life? Put the time in.
The American Heart Association and Sisters on the Mic are excited to bring you Sisters with Heart, a powerful movement of Urban One syndicated radio hosts and co-hosts Jasmine Sanders, L'Oreal, Maria Moore, Shari Nycole, and yours truly, Sybil Wilkes. We're not only sisters on the mic,
we're sisters with heart,
using our voices to build stronger, healthier communities.
Greetings, everybody. My name is Shari Nycole, and I'm here on behalf of the American Heart Association. And today, we have a very important discussion to have with you about HCM. It's best known as hypertrophic cardiomyopathy. It is a very serious heart condition, and it's actually the leading cause of sudden cardiac death in young athletes. I have two amazing people here to talk about this, to dive into this conversation, hopefully help you and your young athlete at home prevent and not react. First up is Dr. Borie. Thank you so much for being here.
Yes, thanks for having me here.
Absolutely. And Coach Desiree Allen, Des, aka Des, who is a football coach, wrestling coach, flag football coach, softball coach.
Correct.
At North Dallas High School. Thank you for being here.
Thank you for having me.
For those who don't have an understanding of what HCM is, I'm still learning myself. Honestly, what is HCM? What does it encompass?
So HCM, otherwise known as hypertrophic cardiomyopathy, it is a type of heart condition. When the wall of the muscle of the heart thickens, it restricts the blood flow. And oxygen in the body is the money of the body. So oxygen has to get everywhere, to our brain, to our heart, to our lungs. So whenever you have this young athlete who may not know, it is presented without symptoms until it's too late, most times. Once the heart is put under stress, i.e. practicing, conditioning, things that you may see when you have your students, they start having things such as dyspnea, which is shortness of breath, and then they may get lightheaded, dizzy, that's low oxygen in the brain. They'll get chest pain, chest tightness, that's low oxygen in the heart. And then from there, the worst case would be sudden cardiac death. And we do see that a lot with young athletes sometimes, where it's like, okay, they were completely healthy, but it's in fact that they probably were not. And as I said, this is something you have to find out through testing because it's inherited from your family. So you can't do anything to get it. You either have it or you don't.
Des, I'll move to you. You know, when I was in high school, I had a physical, and I had to go to a follow-up situation with a cardiologist. It freaked me out, quite honestly. I was okay. But going through that situation and really realizing no one really around me understood what was going on. There was no level of counsel that I could really get other than, you're gonna be fine. So I know a lot of coaches, you all are connected, you know, within your schools, but also even coaches that are in the area. Do you feel like there's a lack of consideration for HCM, like what's going on with that? Are these conversations that coaches in your community are even having?
We're definitely having the conversations, but I do think there's still a level of insensitivity to those type of situations because kids don't want to feel like they're not putting in the effort. They're not going to get an opportunity. If I sit down because I'm tired, I'm not going to get to play. And I've told many kids, I would like to see you live past 20. I don't want you to have a heart attack because of other health conditions, but then this being underlining on top of that or not being in shape, like listen to your body, staying hydrated. That's big. We have to literally put that into the workouts because there's been situations, I tell you, everything occurs because something happened that a coach said, you don't need water. Well, then you've got a kid that passed out, and who's going to take responsibility for that? Your kid is lucky to have a mom that's in the health industry that tells him, no, when you are thirsty, you have to be able to drink. No, if you feel lightheaded or dizzy, that you have to speak up. You have to be your own advocate.
Exactly.
Advocacy, what can and should that look like, especially in the Black community in schools, again, that may not have a certain level of access?
I think for sure advocacy in the Black community first starts at home. I think finding a provider that you trust is huge, especially in our culture. It's no slight to us that we are hesitant to go to the hospital or find a provider. And it is fear, but you can alleviate that fear by becoming knowledgeable about what is going on. So having these uncomfortable yet extremely significantly important conversations in your home, knowing what your family history is, that it starts there. And then we should advocate that we go and get these screenings. We have these conversations with the provider that we trust, because that is a big component for sure. Just being honest and open and transparent about family history, having those conversations, asking questions, and going get your checkups with your provider.
All right, everybody, as we close out this conversation, it would not be fair unless I left you with some calls to action. So there's a few things I want to leave you with here, okay? Number one, I want you to understand the symptomatic and hereditary risk associated with HCM. And please talk to your healthcare team as appropriate. Communicate, communicate, communicate. But that's not all, guys. HCM is diagnosed based on your family history and medical testing. Siblings and parents are encouraged to get tested and, again, to talk to each other, all right? Again, you can learn more at heart.org/HCM student athlete.